Thank you very much. I'm Ricky Sahu, CEO of GenHealth, as mentioned. When we started our company, basically the goal was to solve a lot of the problems here that you're hearing about, which is really fundamentally, you don't understand in healthcare what you're going to get when you pay for it. Because everyone is individual, they come with their own individual medical history. And it's not like buying a TV. When you buy a TV, it's the same TV for everyone. It's the same price for everyone. It's going to have the same picture quality for everyone. But when you buy a knee replacement or when you are put on a medication, the effect of that medication or the effect of that knee replacement is going to be different based on the doctor that did the knee replacement, based on your own medical history, based on when you got it, whether it was in the winter or the summer. So all of these factors really make it difficult for someone to know what they're getting out of healthcare and how much they're paying, based on what they're paying for it. Is it worth paying $10,000 more, or 10,000 lira more, going to Doctor 1? Or is it worth going to Doctor 2 for 3,000 less? You don't really know today, given the way that healthcare data is so complicated, and providers and facilities haven't seen millions of patients. So what you now have with AI is this ability to really look across all types of data and really consolidate all together to build these singular models that are good at everything. And that's what you see with something like ChatGPT, which is a transformer-based neural network model trained on text data. So it's trained on words and phrases and sentences. What we built at GenHealth is a transformer-based model trained on medical event data. So it's taking in procedures, medications, conditions, what doctors you saw, how much it costs, when you had this procedure, all of those events. And with that, we can predict the future of all of those events and of that total cost of care. So we can tell you, based on a patient's past history, what is likely to happen in their future with much more accuracy than you would be able to do with any of the classical statistics. And as the some of the panelists here were mentioning, sometimes you don't have enough data reporting from certain organizations here in Turkey, but I think with these new models, you really have the opportunity to make a lot more of the little data that you have, which is what you see with these ChatGPT sort of models and language. And I think in Turkey, there's a really great opportunity given the federal government's national healthcare system, where you can force reporting from hospitals to the government's insurance. And then you can have both the total cost of care data and the total medical outcomes in one place. That's really difficult in countries like the United States.
Thank you. Benim hemen bir sorum olacak size. Böyle bir sonuç verirken acaba yapay zekanın önerdiği tedaviyi veya topladığı bilginin güvenilirliğini nasıl sağlıyorsunuz? Nasıl bunun arkasında duruyorsunuz?
Yes, so basically we have evaluated our model against the state-of-the-art models that came before it, and we are outperforming those state-of-the-art models in predicting chronic conditions in the future, in predicting total cost of care in the future. And anyone can then run these same models on their own populations and basically hold out the future, don't let the model look at the future, and predict using the past historical data, and then see if the predicted future matched up with the expected future. So if the predicted total cost was 10,000, was the actual cost close or far from 10,000? You can do that for cost, you can do that for all the conditions, the doctors that he saw, all of those events. And that's how we train our model, and that's how we also evaluate the model.
Teşekkürler. Hazirun'dan Sayın Sahu'ya sorumuz var mı acaba? Buyurun. Işıl Hanım.
Thank you. Ricky, so with your system, obviously the earlier the prediction for a patient, the better the patient outcome and the lower the healthcare costs. So I imagine that governments, payers, insurance very much welcome such a technology. At the same time, looking ahead into the future, if you get to actually perfect your technology to the point where you see everything coming and you can suggest through AI the right intervention, are you replacing the doctors? And how would be the adaptability of such a technology to the market?
Yes, so you're right. The more data that you have, the earlier that you have that data, the better the predictions of the future. But it's just like all the other AI technology that exists today or is starting to come into being. You're not replacing the functionality of existing people like doctors. Instead, you're augmenting it and you're making it better and you're making them more efficient. So there's no doctor that's seen 140 million patients like our AI model has. That's just impossible for humans. But doctors coupled with this AI can then help patients in ways that they would not have been able to do before, to achieve outcomes that they would not have been able to do before. Similarly, health insurance plans can now scale nearly doctor-level insights across populations and bring to awareness or alert individuals across the whole population on what interventions they might want to take. In addition to that, you can also simulate different futures, and you can say, what will happen if I give this, as a doctor, what would happen if I gave this specific patient medication 1 or medication 2? How will that affect their future? And which one will lead to better outcomes, which one will lead to lower costs, and choose those paths, or at least use that to inform your final decision-making on which path might be the best.